about 5, 6 years ago now, pain in my knees started, and I thought, oh boy, I have arthritis in my history. And I thought I probably am getting arthritis in my knees also. And at 12 hours on my feet hurt. And I could tell sometimes if I twisted or whatever, it would just make it worse and just get shooting pain. And I started with the injections, the steroid and the lubricant injections and that, and they worked for a little while. Gradually, not so much anymore. And it was starting to limit my ability to be active. Swimming and things like that hurt. They woke me up at night. I couldn't sleep. You know, in 12 hours, I would just about be in tears at the end of a shift. So I went in to see Dr. Schnabelt, and I said, when do I pull the plug and get surgery? And he pulled my x-rays up and he said, oh, Karen, most people would have pulled the plug a long time ago. And I said, well, when can we do surgery? And I was 55 at the time, which sometimes is a little young. They don't like to do it quite that young. So he said, I've been through all the shots, I've done everything else I possibly could, and it was severely limiting my ability to do steps, hills at the cottage, things like that. After much collaboration with my physician, because on our pre-op visit, I asked him how he felt about me water skiing. I've been water skiing since I was 7 years old, and it's a huge part of my summer. I love to be on the water skiing. I live for it. And he said, I don't want you water skiing, Karen. And my face must have just fallen. And I thought, well, okay, we're going to have to discuss this a little further. And we did. We collaborated quite a bit. I actually brought him pictures of me skiing. I've always just gone when it's quiet. So he said, only on glass, which is where my comment came from. And I know he was listening to me because that was my jargon. So I know he was paying attention to what I was saying and understanding what I was saying also. So after a lot of physical therapy and the balance and that, I'm a slalom skier besides. I'm not a two skier. So now this summer, I had probably the best water skiing summer I ever had. And now this summer, before I even hit the boat bubbles where the boat took off, the ski is off. So I've got balance and strength and the ability to get rid of that extra ski as soon as possible and take off. So plus my grandchildren love to watch me ski, and consequently, they've all learned how now this summer too. So I could be active in and out of the boat, helping them in the water. I have the leg strength back. I have the endurance. I have everything probably better than I have in many years. And I have Dr. Schnabelt to thank for that, because I couldn't do it anymore. I would have had to give that up. And I couldn't. He has been fabulous. I can't say enough about his professionalism, his expertise, just him as a person. It's just been a fabulous experience from start to finish. It truly has. And even the girls in the ICU, they'll be following me down the hallway and they'll say, oh my God, Karen, I can't believe what a difference this has made in you. Because beforehand they would all go say, can I get that for you, Karen? Can I do that for you, Karen? And now it's like, I'll beat you to it because of Dr. Schnabelt. It's been an amazing experience. So, and he says, you have to put into it what you expect out of it, which I have. But if you don't have the expertise that he has, you don't get out of it what you need to. So I wouldn't be able to do half the things I can with them. I mean, my grandson said last year I wasn't quite ready to go roller skating yet. And I had taken him, a few times we skated together. And my 10-year-old grandson, I said to him, do you want Grandma just to take you roller skating? I said, I can just sit and watch if you guys want to go. He says, no, Grandma, he says, if you can't go, it's not fun. And I said, oh. So we waited a little while longer, and then I was able to take him, and we did fine and had fun. We went ice skating last winter, bowling, all those things together. So I have to keep up with him. I just had a fabulous experience here from start to finish. Everybody in between, everybody, the CNAs and the medical assistants, the nurse practitioners, physician's assistants, everybody that came in and did their daily in the hospital, discharge, everybody, physical therapy, to the girls at the desk downstairs here. Every time I'd come in, how you doing, Karen? How are things going? You know, everybody, I just had a wonderful experience. And I've also taken that back to my practice in the ICU, you know, and incorporated that, hoping I can give my patients as good of an experience as I had here, truly, and keep that going. So